Ang puso mo, sir, ha? Birthday mo pa naman ngayon.
Ang mas senior ay inaabuso ang mas junior sa kanila. Para bang initiation sa mga fraternity. Pinapahiya, sinisigawan, nilalait in front of many people, pinaglilinis ng CR. May intern na na-rape ng senior resident matapos udyukan na sumama sa inuman. Bali 3 na po ang nagpakamatay. Ibang level na po ito. Yung mga first year at second year, usually, they experience bullying from their senior counterparts. Ang sabi nila, ito daw ay practice na. At ito din naman ang kibit-balikat na sagot sa mga residents na ito na mga nakakatanda sa kanila tuwing sila'y umaalma. Ganyan lang talaga. Kailangan pagdaanan nyo rin. Pinagdaanan namin yan, matatapos din yan. Ano po ba kasi itong pambubuli na nangyari? Ang mas senior ay inaabuso ang mas junior sa kanila. Para bang initiation sa mga fraternity. Halimbawa na lang, pinambibili ng personal na gamit, merienda at pamalengke ng mga seniors. Bumibili ng grocery para sa pantry out of their own pockets. Sinusundo ang kanilang consultant sa bahay at hinahatid na para sila ay mga tsuper. Kaya minsan, ayaw umamin ng mga juniors, ng mga residents na ito, na marunong sila mag-drive. Pinag-babysit ng anak ng consultant. Pinapahiya, sinisigawan, nilalait in front of many people, including patients. Pinaglilinis ng CR. Pinagta-time in para sa consultant na hindi pa dumarating. Pinaglilinis pa ng kondo ng consultant. And I also remember, Mr. Chair, sa UST noon, may intern na na-rape ng senior resident matapos udyukan na sumama sa inuman. At ang mga eras na ito are done both during work hours instead of doing actual work for the hospital. And during personal hours, when the junior resident is supposed to take the rest. Mr. Chair, this toxic practice might have stemmed from a tradition where the senior residents or consultants intended to teach discipline, hard work, and grit to the neophyte doctors. Unfortunately, this tradition has gone out of hand and has gone beyond medical training. The duties being assigned are no longer medical related, going beyond the bounds of labor law, and are violations already of the code of ethics of medical practitioners, and frankly, it is no longer healthy. Ibang level na po ito. The toxic environment can no longer be ignored. Mr. Chair, I'm deeply concerned because apparently, dalawa na po na aking malabalitaan na residents na nag-commit po ng suicide sa isang public hospital, sikat na public hospital sa Quezon City. At isa pong resident sa isang public hospital sa Manila. Bali 3 na po ang nagpakamatay. Dahil stress, dahil palaging pinapahiya, dahil sila po ay depressed na. It seems that they were not able they were not able to handle the stress during the residency training. Kinaya po nilang stress sa pag-aaral ng medicine, pag-take the board exam at kung ano pa. They already have what it takes. But what broke them is the toxic environment during their residency. While I'm sure that this is not true for all circumstances, there are too many reports that have reached me to say that this is an isolated case. We have to protect our medical frontliners by helping them to work in a healthy environment. The nature of their work is highly stressful already. Dapat di na nagdadagdagan pa. Kasi po, Mr. Chair, napapasa po nila itong stress na ito sa kanilang mga pasyente. Siyempre, pag stress po ang mga resident doctors, yan po ay napapasa sa kanilang mga pasyente. Matatandaan ko po, Mr. Chair, hindi ko na mabilang ang mga pasyente pupunta sa akin, nagrereklamo dahil ang suplado ra po ng mga doktor, lalo sa mga public hospitals, nakasimangot, naninigaw. Malaman lamang ko, those are resident doctors. Siguro, sila po ay nakararanas ng pambubuli. Sila po ay sinisigawan. Pinapahiya ng kanilang mga seniors, kaya nagkakaroon po ng chain reaction. Pagdating nila sa harap ng mga pasyente, kagagaling lang sila sinigawan ng kanilang seniors, ipapasa po sa mga pasyente, maninigaw din po sila sa mga pasyente. Yan po ang nangyari madalas na isinusumbong sa akin, mga resident doctors, especially itong mga bagito, naninigaw daw. Ibig sabihin, yun po ay chain reaction lamang doon sa mga nangyari sa kanila mula sa kanilang seniors. Mr. Chair, since the tradition is something coming from above, those from above the hospital hierarchy must take responsibility. The chair of each department exercises supervision and control over those beneath them. I am sure alam nila ito ang kalakaran na ito. They should lay down standards within their department. Number 2, the hospital administration must also work with them to provide a policy for the entire hospital where bullying is not to be tolerated. The hospital administrator, including the board, must take care of their people. Number 3, the DOH, as the regulating department agency, must ensure that all hospitals have fixed guidelines in the implementation of the residency training, and there must be strict implementation of this. Also, the DOH must continue to supervise both public and private hospitals. There are instances where the selections of the heads of the LGU hospitals are left to the discretion of the local government unit. The DOH must make sure that those running the hospitals are capable of maintaining a healthy, efficient, and professional workplace for our doctors. Hindi pwedeng padri-padrino kung sino ang naging hospital administrators kasi kung hindi, walang gagawin mga yan para ayusin ang mga problema sa hospital. The Professional Regulation Commission has the power to discipline our physicians. They are tasked to make sure that our doctors comply with their code of ethics. Pero ang balita ko po, ang mga disciplinary cases sa PRC ay napakabagal daw po gumalaw, parang pagong. Ang mga kasong napafile ay doon lang nagtatapos dahil nainip na din ang mga party sa tagal. Meron pa akong mga balita na nag-file ng complaint ng isang resident doctors first year, nakapag-graduate na siya and all, naging surgeon na siya, hindi pa natatapos yung kanyang complaint. All pa sudden, pa-abroad na siya, saka pa lang dumating at na-actionan yung kanyang reklamo. Ganun na po kabagal ang pag-file ng kaso sa PRC. At yan po naman ay sinang-ayunan ng ilang pang mga nakausap ko na mga complainant. Kung meron man minsan inaabot daw 10 taon, yan na po sinasabi ko. Suggested action. Mr. Chair, I want to see that this practice stops. Pero mahirap po dito, gaya sa lahat ng forms of bullying, walang nagsusumbong. Takot magsalita ang mga tao dahil itong mga biktima will still continue to work in their industry. They do not want to burn bridges and be branded as difficult to work with. And so, let me say it out loud for them. Ayusin po natin ito. Nandito yung Secretary of Health, DOH, and the PRC. Aware po ba kayo na itong matagal nang nangyaring pambubuli sa mga first year and second year resident doctors sa mga ospital? Alam niyo po ba?
Yes, Mr. Chair, alam po natin ang ganitong sistema. Hindi naman po sa lahat ng ospital at hindi po sa lahat ng department. May specific departments na mas matindi ang bullying.
Yes, so alam niyo po. So ano
alam
po yung
po
ginawa niyo nung nalaman niyo ito?
Actually, yung aking predecessor po, yung Health Secretary nung 2021 ay nag-create ng Technical Working Group for a policy on a safe and conducive work environment for medical residents under the medical residency training program.
When was this,
in various
Mr.
hospitals.
Secretary?
This is Department Personnel Order 2021-3129. At nandito po yung
Anong
ating
year po
chair.
yan, sir?
2021 po.
2020, anong month po?
November of 2021. At nandito po yung chair, si
November 20.
Assistant Secretary Charade Mercado Grande.
So ano sabi po dyan sa
Okay, so
memo na yan?
ang sabi po dito, ang residency training program for medical doctors as part of the National Health Workforce Support System aims to ensure quality of training and health human resource development for the health system. In view of enhancing residency training program as the implemented in various hospitals under the Department of Health, a technical working group was created. Actually, yung technical working group's function was responsible for developing a policy for improved implementation of the residency program.
Hindi mapachita kasi konting oras lang ako. Ano po yung mga policy na yon? Paano po na-implement yun?
Yes,
Has it been implemented?
Yes. Ang nangyari po, gumawa sila ng guidelines, department order, guidelines on safe and conducive work environment for medical residents. Pero hindi, nasubmit ito in 2022.
Kaya nga po, ano po yung mga guidelines, halimbawa po, sir?
Andi dito yung, they actually looked at all the residents and very specific yung screening,
Screening
training
of,
process,
screening of
residents,
consultants?
yes,
Screening
and
of residents?
consultants, including consultants,
Okay.
working conditions, workplace support structure and policies.
Okay,
Nakadocument po pero hindi po na-implement. So,
exactly. So, hindi po na-implement.
draft
Okay,
pa lang
bakit po
ito.
hindi na-implement, sir?
Hindi ko po
2021 pa
alam.
yan, 2024 na ngayon.
Hindi pa po ako secretary noon, so nag-change yata admin, nagka-election tayo nung 2022. So, in the
So,
change
hindi
of
po na-implement.
administration.
Aware po ba kayo na meron pong dalawang resident doctors nagpakamatay sa isang kilalang public hospital sa Quezon City?
Aware po ako dyan.
Naimbestigahan niyo po ba yon?
Yes,
May
pinaimbestigahan
nanagot
ko po
ba?
yun.
Kasi nagkaroon ng news blackout. And I understand. Maintindihan ko yan. Pero dapat, you came into the picture at kinorek yung problema, kung anumang problema meron doon, at dapat may managot. Dalawa po ang nagpakamatay. At alam niyo rin po ba, meron isa ring resident doctors sa isang kilalang public hospital sa Maynila, nagpakamatay din. Pareho pong biktima ng PambuBULLY.
Mr. Chair, may I just be clear that handling of suicide is a sensitive matter and there are international guidelines that we follow to make sure that there are no copycats that actually come after. I can submit to the good senator the WHO guidelines of handling.
I
It is
understand
not
po,
a
sir.
news blackout.
I know, sir.
It is
Pero
a very sensitive matter.
I know, sir. Pero at
And,
least man lang, nag-imbestiga kayo
Yes.
at nagpalabas po kayo ng resulta ng inyong investigation at gumawa po kayo ng hakbang na para hindi na po maulit yun at dapat may managot doon sa mga nambubuli, suspension man lang pinakamababa doon sa taong nambuli. Kaya
Yes.
nagpakamatay itong resident doctors
Yes po.
natin.
The hospital directors are the ones enjoined to do the due process for investigations of such cases that happen in public hospitals or any other hospital for that matter.
So ano pong ginawa niyong recommendation para hindi na maulit yung pambubuling yun doon sa hospital na yun? At hindi lang doon, kundi sa iba pang mga ospital na nakararanas ng pambubuli sa mga resident doctors.
So standard po yung policy na yan. Ang trend ngayon is really to look at it from what we call disruptive behavior. So that the trend, ako po isang advocate ng tinatawag na patient safety. Patient safety, one of the dangers of patient safety is yung kinaklaim nyo po na merong bullying in a hospital. And bullying is part and considered as disruptive behavior. Yung mga dinescribe nyo na naninigaw, nagpapabili ng pagkain, these are all considered disruptive behavior. And in the code of ethics of hospital professionals, included ito na against that are banned and hindi dapat gawin. So basically, kung magre-report sila, so ito yung the draft, no? Very important na ma-create in the hospitals an avenue for the doctors that are bullied to be able to have an avenue to have grievances and then to be given also due process because we cannot just accuse people that they are bullies because there are situations, Mr. Senator,
Secretary. The problem is, itong mga nambumbuli, hindi po sila nagsusumbo. They just keep quiet kasi iniisip nila na magtatrabaho pa rin ako rito, baka ako ay ma-brand na reklamador, mawalang respeto at masisira sila sa kanilang mga colleagues at sa medical community. Ang tanong
Hindi
ko po
totoo
talaga,
yan. Meron ding nagsusumbong talaga.
meron nga rin po,
Meron po
pero kadalasan
nagsusumbong sa
hindi.
mga hospital
Like I
director.
did mention to you here earlier, sa experience ko po, maraming mga resident doctors, ang nireklamo ng mga pasyente na sinisigawan yung mga pasyente, binubuli mga pasyente, ngayon naintindihan ko na. Bakit? Kasi they themselves are victims of bullying. Naipapasa po yun. Kaya dapat po talaga meron kayong set guidelines na para ma-monitor at masiguro na itong pambubuli nito hindi na maulit at hindi na pwedeng magawa sa anumang hospital.
Yes, Mr. Chair. My office is open to anyone, any resident in our public hospitals. We have 87, and my office is open for them to complain to me directly. So I used to do this when I was chair as well of a residency program. They get directly to me so I can understand younger residents that will complain. So it's part
Siguro
of
din
the-
po, Mr. Secretary, if I may suggest sa mga ospital na may mga resident doctors, the training, maglagay siguro kayo ng karatula doon na sabihin yung patakaran ay bawal yung pambubuli, bawal yung manigaw, dapat galangin nyo yung mga juniors ninyo, etc. etc. Nakakalat dapat yun kung saan nakikita po ng mga consultants, ng mga seniors at nakikita rin po ng mga juniors. Kasi mahiya naman sila mambubuli. Uy, meron palang patakaran dyan. Ituturo lang ng junior. Di makikita niya, mapapahiya. Hindi nga, and I saw that in some private hospital. In fact, if I'm not mistaken, sa St. Luke's Hospital, merong ganun. Mga karatula na galangin yung mga doktor, galangin yung mga pasyente, nilalagay doon patient's right, nilalagay din doctor's rights. Why don't you do that in all hospitals?
Yes, I will issue a department
Especially in
order
public.
on this. My hospital directors are behind me. Some of them are actually sitting here and listening to this. We will make sure that these reminders are placed in all facilities of the
Can you
Department of
guarantee
Health.
to us, to this committee, na matutuldukan na to once and for all itong pambubuli sa mga ospital, sa mga resident doctors? Can you
Yes.
guarantee that to us?
Yes, Mr. Chair. If for your information, I have an 8-point action agenda as I assume the Office of Secretary of Health. And in this 8-point action agenda, 2 of the action points involve this one. One is number 6, which is ginhawa ng isip at damdamin. And pangalawa is respeto sa karapatan at kapakanan ng mga healthcare workers. Both of these cover this particular issue, which I have also noticed, Mr. Chair. So yan, nakita na rin natin at they always hear me when I visit them. I just visited the hospital in Bohol where we inaugurated the heart center, and I told them, if you want to be a good hospital, kailangan walang masungit na mga doktor at nurses in our hospitals. Thank you, Mr. Chair.
Doon po sa nagpakamatay sa isang kilalang public hospital sa Quezon City, na-address niyo po yun, sabi niyo yung director ay nakausap na, okay, at meron na po kayo na ipataw na parusa. Am I right? Did I hear it right?
We'll
Meron na pong
submit you
sanction?
a copy of our findings,
Okay.
Mr. Chair.
How about po doon sa public hospital naman sa Maynila na may nagpakamatay din? Yun po ba yung na-address ng problema doon? Meron na hubang nanagot? Meron na hubang na-sanction o na-suspindi, etc.?
Ang alam ko po, ongoing pa yung investigation ng...
Ongoing? But that was more than a month ago.
Yes, medyo we ask for due process and hindi ho ganun kabilis ang pagkuha ng information and facts.
And lastly, hindi lang po ito mga resident doctors ang nakatikim ng pambubuli, kundi mismo yung sistema pambubuli sa lahat ng mga doktor. Ibig sabihin, overwhelmed po yung mga doktor natin, whether they're residents or not, junior, senior, sa sobrang daming pasyente, karamihan sa kanila, they can no longer take the stress. Dapat meron kayong monitoring system. In fact, meron sa isang private hospital sa Quezon City, siya po ay senior, nagpakamatay din dahil sa stress. This was before pandemic. I think consultant po ito. So mataas na po ito. Alam niyo po ba ang reason kung bakit marami mga doktor tayo nag-aaral sa pagka-nurse para pumunta ng abroad kasi mababa ang pasweldo rito? At kuminsan kinukupit pa yung kanilang sweldo tulad nung nangyari sa pandemic na dapat yung mga overtime nila mababayad, hindi na ibayad, adding to that stress, boom. Ito yung nangyari. So dapat po both sides din. Minomonitor din po yung mga consultants, minomonitor din po yung mga resident doctors. Kasi yung mga consultant, nakakatikim din po siguro ng pambubuli ng sistema, overwhelmed sila, kulang sa mga doktor tayo. Yung ating precious resources tulad ng mga doktor ay pupunta sa abroad. Dapat po, minomonitor niyo yan. Bakit nagpupuntahan sa abroad itong mga doktor natin? Anong meron? Dapat tinatanong, kinakausap sila. Both ways po yan. May mga resident doctors na bubuli, meron din po itong mga consultant na mga seniors na bubuli ng sistema. I think that is something na dapat pag-aralan niyo po na mabuti, Secretary.
Thank you, Mr. Chair. That's the reason most of the House bills I am supporting, because we really need to increase our public hospital bed system. Kasi nga, overcrowded doon sa ating mga regional hospital. And aside from life or death situation, additional stress na napakaraming pasyente ng ating healthcare workers. So we need to really build all the other hospitals that these good legislators are pushing. So we are in support of many of all of them actually.
Last na lang po, Mr. Chair. Yung pong sa UST na senior ng rape ng resident, doctor, nakasuhan na ho ba yun? Nakakulong na ba yun? Yung taong yun? Alam niyo po yung sinasabi ko, I'm sure nakarating po sa inyo. Pero syempre, we don't have to mention names.
Dapat po kasuhan yun.
Dahil they want to keep it secret and I respect that. Pero ang gusto ko lamang, sana yung nang rape na yon na senior resident, na ni-rape niya yung kanyang junior, nakasuhan na ba yon? Nakakulong na ba yon?
Mr. Chair, rape is a crime, and the avenue for the victim to complain in our court of law is there in our law enforcement. So
I know, I think she did complain. Pero ang tanong ko, syempre dapat kailangan ng support from the DOH, from the government.
yes, we will support the victim if the victim
Well, then
asks
go back
for
to your records and see kung nakakulong na ba yun. Hindi. Kapag hindi pa nakakulong, I will raise hell.
Sige ho po. We will follow up this case, but it's really in the court of law already. If they file the case, then we will follow up.
Ay syempre po, kailangan ng support pa rin. Kasi she cannot do it alone. Depressed po siya. May trauma siya. Kung wala pong support mechanism coming from the government, coming from the DOH, PRC, all by herself, baka mawalang gana yun, baka umatras at mag-abroad na lang. So dapat nandun pakita kayo ng full support hanggang sa makasuhan, makulong yung pong perpetrator. Kung kinakalang mabitay. Ano po?
Yes, Mr. Chair, we will do that.
Salamat po, Mr. Secretary. Mr. Chair,